Hello everyone, and thank you so much for joining us here today. If everyone can make sure that they have one of these handouts, they're available in the top or down here if you do not. So I have the pleasure of introducing Dr. Michelle Holm. She is an assistant professor and the medical director of global health education within Mayo Clinic abroad. Her primary focus includes published research on sustainable projects within developing countries. She has served on 8 medical trips to Haiti during the past 5 years and is very passionate about disseminating medical knowledge to healthcare staff in underserved hospitals. Please help me welcome Dr. Holm.
Thank you so much for coming. It's exciting to see all of you here, and for those of you watching via the webcast, it's been great getting all of your emails thus far this week. It's nice to see all the interest. I saw a quote at the gym today that I thought really resonated with this presentation, and it said, "Knowledge is not enough, we must apply. And willingness is not enough, we must do." And I think that really applies to this presentation because all of us have probably said at one point or another, oh, we'd love to serve, we'd love to use our knowledge to help others. But unless we actually do it, it doesn't do much good, right? So let's get started. So to begin, I'd like to give you a brief overview of Haiti. Now, although Haiti is the poorest country in the Western Hemisphere, the average Haitian eats 1 meal in a day and survives on less than $2 a day. With an average life expectancy of 63 years old, they are some of the most warm, compassionate, and caring individuals you will ever meet. They're optimistic about everything, regardless of what comes at them, and it probably will be the best week of the year if you do decide to go down and volunteer. The purpose of today's talk is to describe the opportunity to serve at St. Luke Hospital, discuss commonly asked questions prior to any medical mission, and we'll also summarize expectations and travel tips when serving in a developing country. Now this is Marcus. I've gotten to watch Marcus grow up over the last 5 years. So he's not just a random boy, but I get to see him every year, and he's very spunky, so he makes it into every one of my presentations. So to start, I'm going to show you a video about St. Luke, what you're going to see, the people you're going to work with, to kind of give you a sense of what it might be like when you're down there.
Imagine a stranger comes to visit you for a few days, and then they leave and begin to tell your town story. Would the story be true? Would it feel complete? When my country, Haiti, is in the news, our story is usually told by outsiders, and we Haitians are not often the heroes in our own narrative. We're here to tell you a different story, a true one, about a side of Haiti that you've heard far too little about. The St. Luke Foundation for Haiti is a 100% Haitian-run nonprofit organization providing education, medical care, housing, and a dignified humanitarian outreach in some of the most challenging places in Haiti, some of the most challenging places on earth. Our programs save lives and create opportunities, combining local leadership with international partnerships. We employ over 1,000 Haitian staff, each devoted with full heart to achieving lasting and durable change for our country.
In the year 2000, a handful of young adults who had grown up together in an orphanage called Saint Hélène came together and formed a plan. They realized that they had the power to remake their communities, and so they started working. Father Rick Frechette, the American priest and doctor who founded Saint Hélène, provided guidance, resources, and mentoring to the team. This was the beginning of the St. Luke Foundation for Haiti. Since then, St. Luke has grown organically. These young men and women, now a few years older, have continued to apply their undeniably successful model. Recognize a need, start small, and grow, one steady step at a time. Simple Street Schools have become a comprehensive educational system for 10,000 students in 30 schools. Job creation initiatives that started with basic vocational training courses have now become large-scale economic development and food production programs. Neighborhood medical clinics have become high-level referral centers. The St. Luke Foundation now employs over 1,000 Haitian staff. At the St. Luke Foundation for Haiti, Haitian leaders lead, and international partners learn, enrich, and support a truly Haitian vision. Our medical programs benefit from educational friendships and partnerships with the Mayo Clinic, the University of Maryland, the American Academy of Neurology, St. Alphonsus Hospital in Boise, and more. In fellowship and with humility, these friends work side by side with our staff, teaching, sharing, and learning. When you hear about Haiti, you don't often hear positive stories about its people. Haitians are often portrayed as needy or helpless. But that's not the Haiti we know. Meet the leaders who run the St. Luke Foundation. They are brilliant, courageous, and devoted, and they are remaking their country. Jean Neves Augustin, the director, and Augustinel Osme, the assistant director, grew up together and now oversee St. Luke's programs.
We spend our time with those people, even they are poor people, even they live in Cité Soleil, even they live in Roi Jérémie. We take them like a family.
Joanne Georges is the head of human resources, managing a team of over 1,000.
Avec tête ensemble, pas gagner nous pas qu'à faire et pas gagner côté nous pas qu'à arriver.
Dr. Blaise co-founded the medical mission, and Dr. Augustin is the current director of the St. Luke Medical Programs.
When you get a patient in front of you, you are able to take a decision and to save his life.
Dr. Jean-Francois runs the hospital, and Dr. Cola is his assistant, coordinating international teams. Dr. Serge runs our Women's Health Center, which includes pre- and postnatal care as well as cervical cancer screening. Raphael Louis-Jean co-founded 2 hospitals and now coordinates our activities in Cité Soleil, including the building of more than 100 houses, a new hospital, a bakery, and more. Rosaline Paul is a co-founder of the mission and not only coordinates closely with partners in Italy, but has been essential to the development of our production center, along with leaders Father Fito and Olsen.
Nous travaillons directement avec vraiment monde qui n'a nécessité et puis pauvre, donc nous à l'aise ensemble avec eux.
Our educational committee coordinates activities and curriculum for the 30 schools in our system. Jaibet Jean-Gilles handles communication for the foundation and also runs our professional school. And finally, Gregory Desir and a team of accountants manage finances.
Léon voyez comme le programme Saint-Luc, comme ça, à le programme directement, et puis comme ça tout, l'aider pauvres, monde qui n'a besoin. Parce que c'est pour ça nous là, c'est pour ça nous travaillons.
Every penny you donate to the St. Luke Foundation goes directly to the Haitian programs being led by these amazing Haitian people. We raise funds through a grassroots model which relies on word of mouth, local fundraising parties, and the power of friendship. Professional accountants in Haiti, like Gregory, steward these funds, and St. Luke is audited regularly by internationally accredited firms. Your donation goes where you want it to, taking the shortest possible path to confront enormous need, provide jobs, save lives, and create opportunity.
Picture an enormous farm. The fields need tending, the soil needs tilling and cultivation, there are weeds that need pulling, there are gardens that need watering. The farm needs work. Now imagine that there's a machine, a tractor maybe, that is built specifically for the job. It's built for the job. It can do the work. It just needs fuel. It needs gas. This is the current reality for St. Luke in Haiti. Our programs are proven, our staffing partners are here on the ground and ready to meet the enormous need. But the machine needs fuel to run. The fuel is your support, your friendship. We fuel these programs through word of mouth, volunteer-based grassroots fundraising, and we need your help. The work is too important. The need is too great. We cannot let these programs run out of fuel. Listen to the children of my country.
Qui ça Haïti besoin?
Haïti besoin l'hôpital.
Haïti besoin d'école.
Haïti besoin de travail.
Haïti besoin de l'école.
Haïti besoin de caille.
Qui est-ce qui a fait ça?
Se nou menm ki kap fè sa.
So a brief overview of St. Luke Hospital. St. Luke Hospital was erected in 2010 to care for the victims of the earthquake. It subsequently cared for the victims of the cholera epidemic and other maladies. Now, in 2016, St. Luke has focused on rebuilding, much like Port-au-Prince has. Many millions of people were displaced from their homes following the earthquake of 2010, and since have been moved back into their permanent residence. St. Luke is also rebuilding. St. Luke is in the process of rebuilding a brand new hospital right now. In the meantime, they're understaffed and they don't have the support necessary to care for the patients that are coming through the door while their new hospital is being built, which is why we are trying to provide this opportunity to help them through this phase. The specific medical needs of St. Luke Hospital at this very moment in time include physicians and nurses. They've requested physicians with ER, internal medicine, cardiology, and neurology backgrounds, as well as nurses with any amount of hospital experience. Now, in the future, those needs may change. They may need people with ICU experience or other staff members, such as physical therapists, pharmacists, lab technicians, but for right now, this is what they are requesting. The volunteer effort contact for this is Win Whalen. I've got his email address here. It'll also be on the last slide of the presentation. It's in the handout for those of you in Rochester, and it's on the Mayo Clinic Abroad website for those of you watching via live webcast. Now, before we get started with commonly asked questions, I do want to reiterate that this is primarily for those of you who are interested in a volunteer opportunity. For those of you who said, I got into this to be a great nurse who wants to help in developing countries, but I don't know a credible hospital. I don't have a contact information. I'm not sure where I would stay. This is for those of you who have wanted the opportunity, but also wanted more information on who to contact, how to prepare, etc. Is Mayo Clinic sponsoring this medical effort? Unfortunately, Mayo Clinic cannot sponsor all of the medical missions that we take throughout the year for all of the employees. So no, this is a volunteer effort, and this would be on your own time and your own cost. Is the purpose of this activity primarily education or direct patient care? Like we talked about, this is primarily direct patient care to help them take care of their patients. That being said, from a sustainability piece of it, I would strongly encourage you, when you're going down and taking care of patients, to provide bedside teaching. So if you're taking care of a patient and you believe the nurses and physicians surrounding you may not know what you're doing, please bring them over and teach them what you're doing so it can be sustainable, so the week after you've left, they can continue those practices. What language do they speak in Haiti? Haitians speak Haitian Creole. All of the physicians also speak French, and you'll see quite a few of the physicians speaking pretty good English, and some of the nurses speaking a small amount of English. Do you have recommended packing lists, as well as books and videos to help prepare for the experience? Yes, we're going to touch on them today, but they're also included in your packet of information and on the website, so you don't feel like you need to write this down. So this is a generalized packing list. I did include on the bottom a small fan, which is not in the handout or on the website. For those of you who like to have it cool when you sleep, as you can imagine, there's no air conditioning, so bringing a small fan might not be a bad idea to help you sleep at night. Book and film recommendations. Toxic Charity is about a book about sustainability, partnering with organizations rather than going down to make change happen. It's probably my top book if I were to recommend any book to read. Mountains Beyond Mountains. This is a pretty thick book. It's written by Paul Farmer, who's the founder and CEO of Partners in Health. And although it's a really big book and it would take a long time to get through, I think it has some great points. For instance, if you're taking care of a patient in a developing country and you're trying to tell them how often they need to take their medication once they go home, but the patient doesn't have a watch, they don't have a calendar, how can you better explain how to take a medication 4 times a day? Well, a great idea that Mountains Beyond Mountains talks about is drawing pictures. So you would draw a half sun to take in the morning, full sun to take at noon, a half sun to take in the evening, and then a moon to take at night. That would be a better way of telling somebody that doesn't have a watch or a calendar or accept how to take that medication. The God of Tough Places, the Lord of Burnt Men. This is a book written by Father Rick Frechette, who is the CEO of St. Luke Hospital, where this medical mission is taking place. The Bottom Billion talks about why it is so challenging for developing countries to get out of poverty. It explains the poverty cycle and the 4 reasons why developing countries can't get out, or the 4 ways that they can get out of poverty. And that can help you understand their situation better before you go down. Sun City Picture House is a film on YouTube about St. Luke Hospital. It talks about a red wagon and how we in America see a red wagon as a toy, but they view a red wagon differently in different places. Half the Sky is a documentary by Nicholas Kristof. Talks about empowering women and the struggles they go through in developing countries. Baseball in the Time of Cholera is about a boy named Joseph, who was actually in the video. He is now in high school, and it talks about his perseverance and optimism despite watching his mother pass away from cholera, also on YouTube. And finally, Poverty Inc. This is a video I would strongly recommend you see. It's very impactful, and I'm just going to show you a quick trailer of it now because we are going to be showing it here at Mayo Clinic next month.
Machiavelli said, the reason there will be no change is because the people who stand to lose from change have all the power. And the people who stand to gain from change have none of the power. That's describing the global aid system today.
I'm glad people want to help. It comes from a good heart. People give us food, they dig us wells, they bring us shoes, and they encourage others to give.
We're going to make poverty history.
The problem is, it does not work.
Foreign aid amounted to a huge subsidy, hundreds of millions of dollars.
Tom Shoes found the right model that captured this love of people who want to be generous and helpful.
Our donations have an unpredictable impact on the local economy. Why would you go buy something? It's for free.
What happened to our cotton farms? That's all gone because of the negative impact of the imports at a second-hand level.
We rich countries that produce a lot of food should sell it to poor countries. It has not worked. It actually created more poverty.
We don't need one more celebrity doing one more campaign. What we need is to no longer be excluded.
No one wants to be a beggar for life.
Emergency disaster relief has become a permanent model.
After 40 years, if you're still here, there's a problem.
I know about countries that develop on trade and innovation and business. I don't know of any country that got so much aid and suddenly became a first world country.
If we really want to help the poverty industry as we know it, has to go.
The sooner we tell a beautiful story about the African entrepreneur doing amazing work, then we will begin to shift mindsets.
Her kids were in a horrible situation, but she started to work. And within 3 months, she had 10 employees of her own.
When you do something, you can see the impact on the population, and you can say, this is because of me.
Having a heart for the poor isn't hard, but having a mind for the poor, that's the challenge.
Having a mind for the poor, something each of you have. You have the ability to not only want to help, but the skill set to be able to help. So I would encourage you to join us. Mayo Clinic Abroad is partnering with Humanities and Medicine to show this film next month. We'll be showing it on Thursday, April 28th at 5:30 in Geffen Auditorium. And we'll also have a roundtable discussion with staff members who have been serving in developing countries to discuss all of these questions and concerns. We'll also have Carol's popcorn and some drinks. So what kinds of patients are you going to see if you decide to take this volunteer opportunity? The Haitian diet is mostly comprised of rice and beans. Fruits and vegetables are really expensive, so you're going to see hypertension and stroke. You're also going to see trauma. Unfortunately, they don't have a lot of street lights, they don't have many sidewalks, and cars break down very frequently, so we see a lot of trauma from accidents. DKA, or diabetic ketoacidosis, we see a lot of because patients suffering from diabetes in Haiti don't have the ability to pay for insulin and syringes. They don't have refrigerators to keep insulin in. Cholera, although it's not at the height of the epidemic, you may see it depending on if you travel during the rainy season. And finally, you're going to see a lot of end-stage diseases that you won't see here. Patients don't have the ability to come into the hospital at the first sign or symptom of a disease. So you'll see a lot of end-stage diseases. The bottom picture is of St. Luke leadership. I know it said in the video that Dr. Kola was an assistant. She is now also a medical director. So the two people on the right are Dr. Augustine and Dr. Kola, and they run St. Luke Hospital. They are wonderful, amazing people that are easy to talk to, easy to ask questions, and they love collaboration and as well as education. Ms. Fenister and Ms. Rock are the nursing leaders. They are on the left. They are also very interested in having you come down to serve if you're interested, and they speak a little bit of English, but they typically have translators with them if you plan to speak to them for a meeting or whatnot when you're there. I just wanted to give you an example of the medical equipment they had. Again, this is on our website. You don't need to write it down. But I wanted to show you that you're not going to have access to the same equipment that you have here. This is a resource-limited setting. So be aware of that when you go down what is available. So what's your day going to look like? So to begin with, Haitians are centered around relationship building rather than tasks. So unlike up here at Mayo Clinic or in the United States, where we may check our email right away in the morning, get our tasks done, take care of patients at the end of the day, we might talk to a coworker about how their weekend was, it's kind of flipped in Haiti. In Haiti, you're met with smiles and bonjour, and everyone's asking about you and your family, and what are you like, and why did you become a nurse or a physician? So it's very centered around relationship building. The shifts are long shifts. Translators are available to help you talk to other healthcare providers and patients. Internet is sporadic. I don't know how many of you remember dial-up internet, but that's about what their internet is like. So I wouldn't recommend relying on their internet, but instead bringing pocket handbook guides down with you, such as Sanford's Antimicrobial Guide, Tropical Medicines Handbook, Nursing Handbooks and Guides. You want to remember to bring your own scrubs to wear. And the other thing I want to talk to you about is donated medications. You won't see the same medications down there that you do up here. They get medications donated from all over the world. So some medications that aren't in the United States because they aren't FDA approved but are used in other countries are down there, such as Tramadol IV. They'll also won't have as many medications as we have up here. They don't typically have a lot of narcotics, so be thinking about that when you're taking care of patients down there. Where will you stay? Villa Francesca are villas that are a 5-minute shuttle ride from the hospital. These were actually just built in the last year or so. They have separate villas based on gender, 6 people to a villa sharing a bathroom. They also have a kitchen and dining area. They provide breakfast and lunch. And they only take cash or cash or check. So remember that rather than just bringing a credit card down with you. They don't have hot water, which might be refreshing after a hot day. And they don't have air conditioning, which I know we've already discussed, but I just wanted to say it one more time so you wouldn't be surprised. Now, safety should be your #1 concern. So let's talk about some safety tips, whether you're interested in this medical mission or any medical mission in a developing country. I would highly recommend that you go to the Smart Traveler Enrollment Program, or the STEP program. And I'm going to show you a picture of the front of their website. So right here, you can create an account. You can put in the country you're going to, the dates you're going to be there, and it will give you updates on any safety concerns so you can be aware of it before you travel. Next, common sense. Don't go anywhere alone. Don't go anywhere at night. We've had hundreds of medical volunteers that have been to Haiti in the last 5 years. and we haven't had one incident. I think that's because we followed very strict guidelines. We went to the hospital and we came home at night. We didn't go out sightseeing, doing any kind of touristy things. So just use common sense when you go down to travel. And finally, the reality is developing countries can change quickly. So I would recommend getting travel insurance. I would recommend watching the STEP program because even peaceful riots can affect your trip. Riots such as oil prices going high, which happens a lot in Haiti versus here. It also is affected if elections keep getting postponed because some people in Haiti believe that the election may be rigged. So they've been moved back again, for instance, to April 24th. So before and after that, even though they may be peaceful demonstrations, that could affect a roadblock from the airport to where you're staying. Finally, remember to bring your Mayo Clinic insurance card with you. So if you were to get sick or hurt, you could call the air ambulance to come and pick you up. Now we talked about a little about these, but I just want to touch on them again. Hot and humid environment, no air conditioning. Okay? Time. Although you want to remember to be on time for your shift, you also need to remember that this is island time. So if you're planning to meet somebody at 3 o'clock and they don't show up at 3 o'clock, be flexible, be understanding, and be aware that relationships are more important than tasks. You're going to encounter barriers. You're not going to be able to take care of patients as easily down there as you would up here. And going into that and knowing that will make it a much better experience for you. I'm sure all of you have been reading about the Zika virus and Guillain-Barré. This is something you can talk about at the travel clinic. They will give you all the information you need, but it's something to be aware of before you go down to travel. Language barriers. Now, although translators are available, they may not be available every time you need to talk to a patient or caregiver. I would highly encourage you to learn as much of the language as possible. So you can Google it. Duolingo is a free app you can put on your phone and learn a little bit each day before you go down. So you can go down and know good morning, good afternoon, bonsoir, merci, thank you, and understand as much of their language as you can to be able to communicate. Now back to the internet. For those of you asking, am I going to be able to FaceTime or Skype with my families in the evening? Maybe. It just depends on the strength of the internet signal. I wouldn't say you're definitely going to be able to, but you should be able to at the least send off an email saying that you're fine, things are going well. And finally, touching back on donated medications and minimal medical equipment. You may see a lot of people pushing IV medications more so than you would up here. That could be for two reasons. One, a knowledge gap of not knowing that they can't push the IV medication. Or two, believe it or not, IV bags and tubing aren't donated as frequently as medications are. So they try to hold back on using bags and tubing unless they absolutely need to. So I would encourage you, if you can give a medication IV push versus in a bag, do that, and it will save them some resources for when they do need them. How much is the trip going to cost? First thing you want to do, you want to book an appointment at the travel clinic. The travel clinic will go through everything with you. They'll show you a video, they'll explain why you shouldn't pet the animals, and they'll give you all the vaccines you need. The cost of that trip to the travel clinic will really depend on if you've been outside the US before. If you haven't, you may need more vaccines than somebody who has. Specific pricing, the flights range between $700 and $1,000. That really depends on the time of year you go, as well as how far in advance you book. The villas are $25 a night, remember, cash or check only. That includes breakfast and lunch. It also includes your transportation to and from the hospital and to and from the airport. They will have a driver to pick you up from the airport. Dinner I estimated at $10 a day. That's just based on what kind of groceries you buy when you're down there and what kind of meal you cook for yourself in their kitchen at night. And the translator being $20 a day. Of course, this doesn't include other expenses that you may buy, gifts which are available to purchase at the villas as well. So what is this going to cost with your flight, the villas, transportation to and from the Minneapolis airport, estimated travel clinic and translator cost, $1,500. For those of you who have never been on a mission trip before, this is not a bad price at all. I paid between $2,000 and $3,000 for past medical trips, past mission trips that I've been on. So this is very affordable. A word of caution before you go down to help you prepare. Change happens slowly. It happens slower than you anticipate, slower than what's been agreed upon. So instead of going down and seeing the things that need to be changed, I would highly encourage you to go down, embrace their culture, ask a lot of questions, and get to know their system rather than trying to change the system. Find the motivation which lies within the system and go with that rather than being the outside motivator trying to change. The culture shock process is something we all go through when we first try to be a part of any kind of mission in a developing country. And if you're aware of it and if you can familiarize yourself with the process, I think it's a lot easier to go through if you can expect it. So the honeymoon phase. The honeymoon phase is the phase when you just arrived and you love the country, you love the people, you love everything about it, you are ready to pack your bags and move there permanently. The fall happens when events start to bother you and you can't quite reconcile them. This could be with direct patient care, it could be an interaction with somebody, and then the bottom out happens when experiences bother you so much that you're ready to leave. You can't take care of patients the same way you can up here. You can't help somebody the same way you can up here. And finally, the refractory period happens when you begin to gain perspective and optimism. You begin to enjoy their culture again. You begin to embrace it, and you are ready to stay. And unfortunately, the refractory period happens typically on the last day as you're about to board the plane for home. Now, I've given you a lot of information today, so I just want to let you know all this information can be found on the web. Now, I will tell you the Mayo Clinic Abroad website hasn't been updated in many years, but for this specific volunteer opportunity, everything can be found right on our homepage. So you'll have more information on the commonly asked questions, you'll have Win Wayland's contact information, more information on St. Luke Hospital, more information on the villas, as well as that medical equipment packing list and those kinds of checklists. If you haven't already written it down, be sure you write down the Poverty Inc. film. We'd love for you to join us on Thursday, April 28th to see the full film. And lastly, Wynn's contact information. I am happy to answer any questions in these last 10 minutes we have, but if you have questions about the schedule, if your skill sets are helpful, when you can go down, if you should go down, when is the contact information. My goal is just to provide you the information necessary for those of you looking for this opportunity. So do you have any questions for me?
Yes. So if I understand correctly, there is no group going down at a particular time, it's all individual?
The question is there a time when a particular group is going down? St. Luke Hospital has volunteers from everywhere that go down. So you will be with other volunteers in the villa. As for Mayo Clinic, they may try to partner people that are all from Mayo Clinic that are interested in going down, but that will be their decision as to if the week that works for you works with other people from Mayo Clinic, or if they will come to pick you up and you will be staying with other medical volunteers from other parts of the country. So no, there is not a specific date for a specific Mayo Clinic group. Well, thank you so much for coming. Have a good day.